To expose healthcare people. This is your host, Steve Mallon. So I had a thought at the gym today. Instead of reading my articles on my newsletter, which is probably not the most entertaining thing, um, is reading my LinkedIn feed, which has a lot of really cool healthcare people, and they share some really cool things, and kind of recording my reaction to what they're saying, my thoughts on it. I mean, my network is exposing the healthcare system every day with their posts, so it'd be kind of a cool experiment. I'm going to try it. Would love to hear your feedback in the comments regarding this format, but also your thoughts on the different things I'm going to point out. So here goes nothing. All right. So this is my contact, Marie Wilda, really cool person that used to be the chief revenue officer at Pharmacy Development Services, this like consulting firm for pharmacists. What is she saying? I've seen this formula a lot lately. I've even caught myself using it in an email. Yes, it's easy to use and recognizable, but if everyone says they are the Uber of something or the Netflix of another, you're not doing your brand any favors. It dilutes the impact, making it less meaningful and question it accurately representing your offering. That's actually funny because I do that all the time, and my wife yells at me for it with my previous businesses. I was like, "Oh, we're the Amazon of this, blah 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 blah." So not exactly healthcare, but I mean, if you're going to health tech and you're trying to create like or a healthcare company, maybe don't say you're the CVS of this or whatever. The Netflix for healthcare, right? Let's say you're creating video resources for patients. You don't want to say you're the Netflix of healthcare, and I believe it. It's not genuine. It's sounds like fluff. Got some Spikevax here. Yes. Interesting note with the Spikevax. Very complicated stuff with the refrigeration and storage. I was working at an independent pharmacy, and they were thawing it incorrectly. So I had to like explain to them how to thaw it properly because I could find it. Spikevax thaw handling thaw. Um, where's that image? Uh, uh, handling. Sorry, just want to make sure I pull it up properly. Um, Thought instructions. There we go. What? Oh, yeah. So the complicated thing is there's like different types of Spikevax, and it has different thawing instructions. So the independent pharmacy I was working at thought they were doing it. They were doing it for like the multi-dose vial, but they have there's single dose vials as well. So the multiple dose vials have to thaw for 2 hours, and then you let each stand at room temperature for 15 minutes. They thaw in the refrigerator. They were doing the single dose syringes for 15 minutes, but it's actually 45 minutes for that. So, um, I guess the expose with that is with independent pharmacies that it is a cool thing that it's personalized. However, with there are less controls with the preparation and handling of the vaccines. I've seen that firsthand, and several independent pharmacies were not doing it properly, and that would like never happen, or not never happen. It would be less likely to happen at a chain like Walgreens, CVS, because they have so many controls in place and instructions and um yeah, it's kind of the shady thing about independent pharmacies. Next, HIV Alliance. Please consider supporting this great organization. They provide necessary services, including prevention tools and education to stop the spread of HIV. Nothing really to say to that. Dr. Alex Barker, really cool guy, founder of Happy Farm D. 89% of pharmacists said they'd take a pay cut for a remote job. Holy crap, absolutely. Yes, especially during COVID, there was a lot of FOMO on pharmacists, including myself, with our friends who are working remote. Meanwhile, we're like driving to the pharmacy and like, ugh. Um, what motivates me, Alex, would be uh it's kind of all of these: better work life balance, flexibility in hours, location, escape from in person. I guess it's just overall better work life balance. Yeah. This guy's not healthcare. Israel stuff. Not going to talk about that because it's healthcare. Sharif El Nahal. He used to be New Jersey head of Department of Health. Really cool guy, and became the Secretary for Health at VA. We have now placed more than 38,000 homeless veterans into permanent housing. Amazing. Really good stuff. As a pharmacist, I witnessed firsthand homeless problems, and the police were surprisingly very not helpful. I worked in a town. I'm not going to say the town because I don't want to shit on the police there, but I called him and told him about the homeless situation. The patient was sleeping out of our waiting room and sleeping out of our parking lot in the middle of the winter at night. And I called the police and they said, "Oh, we can't do anything." Very disappointing. And come on, that affects health. Let's be real. If you're homeless, so and veterans especially, like dealing with such uh PTSD and such powerful mental health issues, and just being left behind. So amazing work to Dr. Sharif Al Nahal for making some good changes there. Mercedes Benz, not healthcare. Not healthcare. All right, Bijou Shah, cool guy, telehealth guy. I've been contemplating the idea today, the notion of removing pharmacotherapy from PharmD programs. I respectfully disagree. Earlier, I came across a post suggesting this and it surprised me a bit. With more pharmacists have a voice on this platform, there's an increased need for added responsibility. Pharmacotherapy is a key component of our education. Simply replacing it with something else isn't a pragmatic solution. When I learn a pharmacist performing at the top of their license, whether under collaborative practices or otherwise, I'm always impressed by how much progress pharmacy practice has made. The evolution of pharmacy in the past century has not been without setbacks, but the vision for patient care has always been the North Star. In fact, one of my former mentors often discussed how the Hilton proved to be a watershed. It opened up a national. I don't really understand why anybody's saying that we should get rid of pharmacotherapy. That's like the basic. That's the basis of pharmacy. I don't know. Kelly Carson, really cool oncology person, expert. I don't know the concept of why that was suggested, but seems strange, especially in the world of oncology where drug knowledge is really critical to understanding treatment selection toxicities. I'm sure there are many pharmacists that don't use pharmacotherapy knowledge on the regular. That makes no sense to me. How could you, as a pharmacist, not use pharmacotherapy knowledge on the regular? Like, how can anybody be suggesting this? That's like dentists shouldn't learn about dental hygiene, or not even dental hygiene, dental disease, or what? Okay, some guy says the unfortunate reality is that most pharmacists are not able to use their pharmacotherapy skills in practice as much as they should and could. That's true. It doesn't mean they're not using pharmacotherapy. And that's not a function of desire. It's a function of how we're valued in healthcare. Reimbursement of goods versus reimbursement of cognitive services. The retail pharmacy environment is in many cases a mess. Sure, but still, come on. We are still using pharmacotherapy. Like, even if a patient's asking about if I can take Tylenol with alcohol, that is pharmacotherapy at the end of the day. Now, Psychedelic Pharmacists Association, so cool. Kristen Spear, one of my good friends, is on the board there, and this organization is at the cutting edge of where pharmacy should be concentrating. At least part of their definitely should be concentrated because there's not a lot of medicine in there. I just taught a course on psychedelics, psilocybin specifically, and the clinical trials are quite promising. Not there yet to strongly recommend very specific things, but definitely getting there. Um, Definitely recommend people to join. Will we see you in Portland this weekend? The Psychedelic Pharmacy Association is proud to be a community ally of Horizons PBC and the second Horizons Northwest Conference on December 1st to 3rd at the Portland Art Museum. Use discount code Horizons Northwest Science and Psychedelics. Presented by Horizons PBC, a public benefit corporation in partnership with it. Yeah, really cool that people are focusing on this. It's very similar to what happened over a decade ago with medical cannabis, except this is gonna explode compared to medical cannabis. Things were very slow with medical cannabis, almost rightfully so. It's kind of like uncharted territory, but medical cannabis is definitely paving the way for psychedelics. Not healthcare, not healthcare. Anti-Semitism is running rampant in the medical profession. A recent report concluded that anti-Semitism is running rampant in the medical profession, besides anecdotal evidence of doctors speaking out in favor of the October 7th massacres in Israel and pulling down posters of the hostages. Do No Harm found that only 11% of medical association and 3% of medical spoke out in support of Israel after October 7th attacks by Hamas, which stands in stark contrast to the 71% of medical associations and 45% of medical schools that spoke out in support of Ukraine after it was attacked by Russia. Wow. Yeah, that's a crazy number there. Whew. Oof. As Dr. Stanley Goldfarb notes in this interview, how can doctors fulfill their Hippocratic oath? They harbor anti Semitic views and such disdain for the value of human lives. Meanwhile, Israel has a long standing and well documented history of treating Palestinians in Israeli hospitals. This medical treatment has even been provided to family members of Hamas leadership. Yet somehow Israel is being falsely accused of many of indifference toward Palestinian lives, and in fact, Israel is being falsely accused of committing genocide and ethnic cleansing of the Palestinians. Yeah, so I'm glad someone brought this up in relation to medicine because I think it's important. I skipped the posts that have to do nothing with healthcare. However, this is talking about anti-Semitism in healthcare, and I experienced it myself for my patients. I had two patients that I give flu shots to. Um, a few weeks apart, and they both, for some reason, said they don't like Jews. I don't know how it came up that I'm Jewish. I don't remember, but it did come up, and they both said, "Oh, I don't like Jewish people." Um, and so I know I have experienced it myself. Uh, and this, yeah, I mean, I guess you could say it's more complicated the situation, between Israel and Palestine versus Russia and Ukraine. Russia came in, attacked. There was not a a long. I guess there was a long history of problems between Russia and Ukraine, but yeah, this difference in percentages is hard to swallow. It's sad. Um, yeah. All right. Hopefully, this is something a little more positive. Calling on healthcare professionals would like to add an easy new cash revenue stream to their offices this holiday season. Are you the owner of a small business healthcare or wellness space who's looking for a quick and simple way to generate cash income while providing value to your current patient and client base? If this sounds like you, please continue reading this post. The medical aesthetics industry is growing globally at a rate of 11% per year through 2027. And guess what? The large driver in growth is desire for minimally or non invasive procedures. This segment, non surgical cosmetic procedures, grew 5%, 0.7%. The large segment, medical aesthetics, is facial. Let's look at an example. So before I continue saying what this guy wants to sell or this woman wants to sell you on, I know a few doctors who are standard medical doctors in the just general medicine space. They're PCPs that are getting to medical aesthetics, even cash on the side, like a side gig and setting up an office. And I mean, it's like all cosmetic medicine, or I don't even want to call it medicine. I guess it's all like cosmetic stuff, plastic surgery. It's if people want to do it for cash, why not? And this is a good option for doctors. But why is it a good option for doctors? It's a good option because the standard insurance billing system has failed them. And there's so many different insurance companies. The the it's like an art to bill them properly. You have to hire these medical billing specialists. How much resources are wasted on perfecting these medical billing schemes, and how many doctors' offices are doing sketchy things with this billing, and pharmacies doing sketchy things with their billing. There's all sorts of ways you can do it. And one of the reasons why is, once again, there's a lot of different insurance companies, a lot of different billing things. They're all reimbursing differently. You have to bill for 1,000 to get $200. And that's why there's a big push for single payer to kind of like take away this like uncertainty, which causes waste for the healthcare system and influences doctors and pharmacies to push for services and products that are not necessarily in the best interest of the patient, but in the best interest of the bottom line of the doctor's office and the pharmacy, or the hospital, which is, you know, fine, but it creates this conflict of interest that's not always in line with the doctor, with the patient. Uh, Not medical. Let's see. Longevity. Who wants it? I was having a celebratory dinner with some people in their late 20s that I know very well. I mentioned an event that Frank Losa graciously invited me to with some of luminaries of the longevity movement. I mentioned that I was having some trouble reconciling my personal expectation, expectation, I think, of long, healthy life with the fact that the US as a whole faces declining life expectancy, even factoring out COVID. Those living outside of the relatively wealthy cities or suburbs, or living in poverty and or unhealthy environments, who feel uncertain or disrespectful, have seen their death rates increase by 560% over those who do not. Wow, that's crazy. So this inequality is strong. Chronic disease and behavioral health, substance abuse disorders account for nearly all of the increase. Makes sense. I concluded by saying that I wanted to be part of bringing increasing longevity to everyone. But whatever happened with those efforts, I fully expect to live to see 100. And these happy and healthy young adults could expect even longer quality years of life. All three immediately loudly made clear their absolute opposition. They didn't want the extra years, even if they could be active and healthy. They couldn't be swayed. By 80 or so, they would have done what was worth doing and be ready for a graceful exit. None of them check any box in the frailty index I'm posting here. They all love their lives, are succeed in their professional lives, are physically and mentally healthy, have strong social networks. They each have a strong sense of purpose, are aware of their good fortune and grateful for it. It suddenly occurred to me that the vast majority of the US isn't prepared for the chance to add 25% more time to their lives, let alone some of the figures that. Yeah. Uh, how do I feel about it in terms of this? Why do they not want it? I mean, despite having all these things that the guy is saying, active, healthy life, um, succeed in the professional lives, physically, mentally healthy, strong social networks. Loneliness, though, is still strong social networks. Mm, Maybe not loneliness, but this like feel of doom is still around, especially in the young people with COVID, 9/11, COVID, wars, this like climate change thing. It still feels like the world is ending, and you don't want to live too long, um, because it's like horrible. I do think this longevity problem is a crazy thing. The fact that poor people are have death rates increasing by 560%. Like it's one thing if those to be stable, like you're poor and you have a higher death rate. I mean, that makes sense. You have more stress, less access to care, all that kind of stuff. But this is increasing, so things are getting worse for poor people. So I don't really understand why that's happening from the perspective of expanded Medicaid and Affordable Care Act. From a healthcare perspective, poor people seem to have had a lot better increase in available services. So why are they dying at increased rate? Why do they have higher drug addiction, chronic disease, and all that stuff? Something interesting. I think we are good. I don't want to make this too long because I'm kind of just like reading different posts and stuff. But yeah, like I said before, I would love to hear your feedback on uh, first of all the things that I mentioned, or some of the things that I mentioned that you find interesting. Also on the format of this, which is kind of strange, but yeah, it's been interesting. I kind of don't want to spend time on LinkedIn passively. I don't want to do it like all social media. I took off all social media from my phone, all of it, including LinkedIn, all sorts of news. But I'm still finding that on my computer, I'm still gravitating to LinkedIn. So I feel like doing this as a video is more meaningful. I'm doing it more deeply. I'm reading through it. I am talking about it, and yeah, um, yeah. So yeah, thank you for listening, and would love to hear your comments on it. Peace.